Sarah in short. Thank you. A very warm welcome to all the government representatives who are with us today, our partners, Changing the Way We Care, UNICEF Child Protection colleagues, the various CSO partners working in the area of care reform in the region and beyond. You are all very much welcome. Before we start, a quick overview of the webinar protocols. Please ensure, if you haven't done so already, to introduce yourself in the chat box. But I'm also requesting Emily and Bertha to administer a poll so that you can all fill it in to give us an indication of where you're connecting from. We'd like to know who is with us, whether it's the UNICEF family, the government, CSOs, and which part of the world you're connecting from. So please take time to just fill in that questionnaire, this survey that has just been posted, the poll. Take time to respond to that, and we'll also at the end be able to see how who has connected from where. Participants are reminded to mute your microphone during the session, and you're all encouraged to type in the chat box any questions or comments that you may have. We'll ensure that to respond to all the questions and address your comments. You may also use the raise hand icon if you want to ask your question or make your comment directly. And just as a reminder, you've heard at the beginning, this webinar is recorded and will be shared after this session for your reference. If you'd like to join the mailing list that we have for future platform events, we'll also share a link where you can register to receive information directly to your inbox. Alternatively, you can write to Emily Dillap or myself, and introduce yourself with your job title, the organization you're working from, country, and of course your email address, and we can include you in the mailing list. So let me give you a quick overview for those who are connecting with us for the first time and those who are rejoining some of the sessions we've started. So just a quick overview: the regional learning platform on care has been established by UNICEF SRO, Eastern Southern Africa Regional Office, in collaboration with Changing the Way We Care. And the purpose of this platform is really to exchange learning on care across the region. The management of this platform is supported by a consultancy firm called Child Frontiers, and we have Emily Dillap as the lead consultant for this work, with a team of other consultants, Bertha, who is also on the call, and also we have Ismail. This platform is dedicated for us to share learning, particularly with the government, UNICEF and CSO partners in Eastern Southern Africa region. And it started back in October 2020, and we've been conducting virtual study tours, a series of webinars, and we also have a help desk where you can write to us, Emily or myself, with any question that you have on care, and we'll ensure to respond with the right and appropriate information that you need. We are now in phase 2 of the learning platform, which is actually coming to an end this January, and moving smoothly on. We are entering into phase 3 of the learning platform to continue this learning up to October of this year. The learning needs are met through webinars, small group exchanges, practitioner videos, documentation of case studies, and of course the help desk, as I mentioned. And we also we generate a monthly newsletter with all information about the platform, but also information of upcoming events and sessions. The webinar today is with the title Keeping Care in the Family, and we're going to get an opportunity to learn from 3 countries, basically looking specifically at different strategies for building strong families and communities and preventing child and family separation in the region. We'll have a moderated panel, and we'll start with colleagues from UNICEF Rwanda, who are going to look at the family strengthening and community-based care support for care of children with disabilities. And then we'll move to Kenya to learn more on the approaches that they use for preventing double separation among teenage mothers. And then lastly, we'll hear from Zambia on their family preservation and empowerment strategies. After these 3 interventions, a panel discussion in particular, we'll proceed to have a moderated discussion on lessons learned and priorities for preventing separation in the region. Just as a reminder, all the information shared through this platform will be sent by email and also be made available in a link that we'll provide in the chat box. And just to clarify, all questions, comments that you have will be taken at the end, and you can also feel free to interact directly with the panelists by raising your hand. Without further ado, I'll now hand over to the moderator, Ms. Erica Dahl-Brenedin, who is of the Changing the Way We Care organization, to introduce the panelists and take us through the moderated panel discussion. Over to you, Erica. Erica, you're on mute.
Okay, thank you so much, Mona. Let me see if I can manage this. Okay, trying to get my screen to advance here. Okay, wonderful. Welcome all. I'm Erica Dahl-Bredin. I work with the Changing the Way We Care initiative, leading our global influence, learning, and engagement work. And it's a pleasure to be here today moderating this conversation about strategies for preventing child-family separation. I think we've already gone through the agenda. We're actually going to switch up the order a little bit of the presentations today. We'll be starting actually in Zambia, then moving to Kenya, and finally concluding with our colleagues from Rwanda. So a lot of exciting learning and experience to hear about today. But before we get started with our panel, I wanted to just take you through a very brief look at this simple graphic. It's a graphic that we use very much in Changing the Way We Care to present a holistic model of care reform that has three essential components. You can see alternative care at the bottom. To the right, transforming or transitioning from institutional care to family care. And then on the left, there is prevention and family preservation. And today we're going to focus on that piece of the pie, that third, if you will, of this model. It's an essential part of care reform, as we know, but one that is sometimes overlooked or not given quite as much importance. And I want to show a little bit about how, I'm not sure if you can see my screen there completely. Let me try to get rid of this bar at the top.
Yes, we can see it.
Okay, this here just shows a little bit about the emphasis that the 2019 UN resolution on the rights of the child has given to prevention. I know many of us on this call were part of the advocacy efforts to get this resolution passed. And it does give an important emphasis to prevention. And so I wanted to highlight this particularly in Article 34. The resolution says, it urges states to take effective action to provide support to families and prevent the unnecessary separation of children from their parents. It mentions several types of actions. I won't go through all of them, but there are three I wanted to highlight. It calls on states, member states, governments, to improve the implementation of policies and programs, budget allocation, and human resources to support children, particularly those with disabilities, those living in disadvantaged, stigmatized, and marginalized families, to address the root causes of family separation. It also calls on states to develop inclusive and responsive family-oriented policies and programs for poverty reduction. And we'll hear more about this, strategies to help parents' ability to care for their children. And then finally, it calls on member states to adopt and enforce laws, improving the implementation of programs and human resources to support children with disabilities and those living in other disadvantaged situations. So today we're going to hear a little bit more about how this is put into practice in 3 different countries. I think this grounding, this endorsement from the UN resolution is really an important tool for advocacy and influence that we can use at the country level. But we also want to hear about actual implementation strategies, the successes, the challenges, the learning that's coming out of these 3 countries, Zambia, Kenya, and Rwanda. And so our first panelist is from Zambia, Ms. Chilala Muitwa Shilimi, and I apologize in advance for massacring your names. I'm sure I'm not pronouncing them all precisely, but Chilala is a Zambian citizen. She's married with 3 sons, a certified social worker with extensive experience working with children in vulnerable communities. She works currently with ACE Zambia, which you'll hear more about, managing their family preservation and empowerment program. Previously, she worked as district social welfare officer with the government of Zambia, juvenile inspector and probation officer for children in conflict with the law, and a supervisor for Care International's Village Savings and Loan Associations, among other positions. She has bachelor's and master's degree in social work from the Herzan State Pedagogical University of Russia. So without further ado, Chilala, we'd love to have you unmute and see if I can get my slides to advance. Okay, there we go. And if you can just prompt me, Chilala, when you'd like me to move to the next slide, you're on. Go ahead, please.
Thank you so much, Erica. Hi, everyone. I hope I'm audible enough. So as already introduced, I'm Chilala, and I will just take you through the program that I manage at ACE Zambia. So the first slide is just talking about who we are as ACE. We're a faith-based organization, and the organization was founded in 1969 in the USA. It started operating in Zambia in 1998. So we are child-focused, and also family-based care is something that we really emphasize on.
Go ahead, Chilala.
Yes, I'm trying to prompt you for the next slide. I will just. So the work that we do, we focus on child welfare. We have 2 transit homes where we're taking care of children from the age of, from a day old to about 5 years. And it's generally child welfare, making sure they get the care they need while they're in our 2 homes, and ensuring that at the end of it all, they're reintegrated back to their families. We have family preservation, which I will go into details later. We also have the emergency family-based foster care. This is an initiative where children have to go into a family setup as opposed to them going into institutional care. Then we also have the foster care and adoption. We have education. We're working with 7 community schools, just ensuring that children that cannot afford to be enrolled in schools, government schools, they can at least access the community schools. I'm sure we agree that most of the children that have been separated from families and are in childcare facilities, the reason for separation sometimes is education, lack of access to education. So we want to ensure that this education is available for them in the 7 communities. We also have training and capacity development for other partner organizations. And we also have the ACE Transition Partners, which is being run mainly by ACE USA, where we are focusing on training other institutions, other organizations on how to remodel to family-based care. So the key question is, how do we economically equip households and vulnerable communities? And we can do this through keeping families together before the separation actually happens, which is prevention, as well as if it has happened, then we have to respond through our response pillar. And that is reunifying a vulnerable child back with their family or original caregiver. But we want to ensure that this reunification is sustainable so that the child does not return to the child care facility. So family preservation and empowerment program it falls under our prevention pillar. As earlier mentioned, we have two pillars, the response pillar and the prevention. The response is where the children actually come to our two homes. Under prevention, we're focusing on family preservation and empowerment. This is a program that started way back and has evolved over the years because we've introduced a lot of different components just to suit the demand and the needs of the people in the community. So you will see from the numbers, we've served 3,746 children and 3,288 families. Currently, the number is higher than this. This is because we had some families that were enrolled specifically on the graduation approach. So coming to the graduation approach is an intervention under the Family Preservation and Empowerment Program, which is trying to, the aim really is to build the capacity of vulnerable households, just to help them move beyond extreme poverty so that they are self-reliant and can meet their own basic needs. We do this by building secure, sustainable, and resilient livelihoods. The GA is ended to make positive contributions to the welfare of ultra-poor households through a comprehensive, time-bound and sequenced core element or interventions to the household. So the intervention that we're giving them is a comprehensive one. We've decided to combine different services so that it's some form of intensive family support. And then it's also time-bound. When we started the Family Preservation and Empowerment Program, we could have families on the program for a very long time, because for others, immediately the first child graduated from our program, they would come back to us to say they have another child that needed help. So we assessed all that and saw how best we could help the communities better. So under our graduation approach, we're giving them comprehensive services, and we're ensuring that it's time-bound. The timing is 2 years. So the family will be on the program for 2 years, after which they are graduated from the program. So the core elements or interventions to the households are the ones that are listed. We have entrepreneurship, business acumen, and financial literacy, which we feel is very important before we can actually introduce them to businesses. They need to know how to run their businesses. Then we have the seed capital provision and consumption support, which usually the consumption support is supposed to go on for a year, and the seed capital provision is once off. The next one is positive parenting skills. We ensure that the beneficiaries actually receive positive parenting skills, because we do realize that sometimes separation is as a result of poor parenting skills. We also have another component of savings and loans. This is where we're just trying to make sure they understand the importance of savings, and also they have access to loans through their village savings. Mentoring and coaching, counseling for the families. So mentoring and coaching is very important, because we need to keep going and just seeing what they're doing, mentoring them and just guiding them to ensure that their businesses are thriving. And the last one is monitoring, which I cannot overemphasize because it has really worked for us. We want to ensure that the monitoring is done as often as possible when needed. Then we have the selection criteria. This is the criteria that we used when we were enrolling the families on the program. You will see a picture on your left side. That's a picture of some of our beneficiaries that graduated from the sausage making class. This is one of the life skills that they benefited from. So some of the life skills that we provide are tailoring, would have doormat making. We do an assessment looking at the needs assessment for the community before we can actually come up with the skills to offer them. So those are the criteria that we looked at as listed on the slide. The indicators for the graduation approach are as listed. The first one is, this is at the end of the 2-year period. The indicators, the first one is eating at least 2 cooked meals per day all year round after a 12-month period. The second one is productive assets at a certain threshold. This is expressed in terms of value or number of assets. So we compare the assets that they had before and the ones that they have at the end, at the time that we're doing the evaluation. The household have at least 1 viable business. And the next one is maintenance of minimum savings balance for at least 12 months. So all beneficiaries are expected to belong to a savings group and maintain a minimum savings balance, which is about $34. That's the minimum. I'm glad to say that at the end of the program, when they were graduating, we had a number of them that had saved way more than that. Then the last one is participants engaged in household decision-making, e.g. asset purchase. So we have some beneficiaries that have actually managed to buy land and start building. So the figure that we're seeing is just a summary of the graduation model. And you can see that what we're trying to achieve is that at the end of the program, the families should have crossed the poverty line and are able to reach the sustainable livelihoods. We want them to have access to credit. So in the beginning, when they start, we can see where we have savings, we have skills trainings, we have asset transfers. At the end of during the whole process, they have access to savings from their savings groups, the village savings groups. But the whole idea is that when we are done, they should also have access to credit elsewhere apart from the savings groups. It could be maybe some banks, because we now have banks that have come on board and are targeting the communities for small loans. I will now take you through the findings from the evaluation that was done in August, and we're just trying to see the results from the families that had benefited from the intensive support services under the graduation approach intervention. We noticed that the majority of the beneficiaries are female, as can be seen, 171 of them, and males, we only had 1. Who is the head of the household? The majority were female again. And then the household size, the majority was from 4 to 6 members.
Sorry, could everyone please just mute? If the other participants could mute your microphones. Thank you. Sorry, Chilala, please continue.
Not a problem. We can move to the next one, Erica. Okay, and then when we look at the findings on the number of meals consumed per day, this was at the end of, after we had provided the intervention. Before the intervention, we could see that most, actually all of them, were only having one meal a day. After the intervention, 5.4% were having a meal once and 57.6% twice. it was very gratifying to see that we actually had some that were now managing to have 3 meals a day at 7.2%. Number of income sources. 44.8% had one source of income, and then 51.7% had 2. Then we had those that had 3 and the ones that had 4. So the majority had 2. We also looked at the access to loans before and after joining the VSLAs. Before they joined, only 9% accessed loans and 91% did not access. After the intervention, 100%, all of them at least accessed loans once or twice. It was interesting to know how they were using these loans, what they spent the money on. And we found that 9.3% used for home supplies and groceries, 3.5%, some of them used for medical expenses, some of the money was used for school fees, some of it was used for buying clothes for children, it was used to repay debts, others invested it in businesses or livelihood, and also acquisition of plot or land. So in summary, prevention avoids separation via economic relief, and sustainable reunifications maintains placements. So if we prevent the separation, it's possible to prevent separation via economic relief. And we're grateful that the people that benefited are still running their small enterprises, and we continue working with them and encouraging them. Zikomo. Thank you so much.
Thank you so much, Chilala, for this very interesting innovative work that you've presented from Zambia. I'm sure some of our participants would like to learn more about the methodologies and the tools that you're using. So we really encourage you, as Mona said at the beginning, to also connect with one another and to ask for more information about some of these approaches. So thank you so much. We are going to move on now to our second panelist, Ms. Joan Muburo. She is from the Macheo Children's Organization in Kenya, which is also a member of the Association for Alternative Family Care of Children in Kenya. The association connected us up with Joan and with Macheo's work. And she's going to be talking to us today about a different aspect of prevention, really looking at how to help prevent double separation, particularly among teenage mothers. Joan is a mother herself and a program manager for child care and protection and mental health support in Macheo. She has a background of community development and project management and counseling psychology. She's worked in this field for more than 15 years. Her experience includes prevention of separation services, family reintegration, and placement of children into other forms of care, primarily working in Thika in Kiambu County in Kenya. She's also worked closely with the Kenyan government's Department of Children's Services in various ways, including the development of standard operating procedures for different forms of alternative family care. So thank you so much, Joan. We welcome you to please come off mute and share your presentation with us. Thank you.
Yeah, thank you, Erica. Hello, everyone. Today, I'm very happy to be able to present to you our work regarding double separation, preventing double separation among teenage mothers in Kenya. As Erica has mentioned, we are mainly working in Thika, Kiambu, in Kenya. Next slide. Erica?
Can you see the next slide?
Yes, I can see it now. Thank you.
Okay, sure.
Yes. So Mature Children's Organization, our mission is a society where children live happily in a safe, caring, and stimulating environment. And our purpose is to release restrained potential in children, whereby our mission is to empower these children and their communities so that they can lead a bright future. Next. Next, Erica.
I think there might be a little bit of a delay on your end. I'm seeing the next slide. Do you see a Maceo's approach? But I
Yeah,
think
I can
might
see
be
it now.
Okay, I think it's a little bit of a delay for some reason. Sorry.
Sorry about that. So in our area of operation, we meet a lot of complex issues. And because of the complexity, we apply a holistic approach to the individual clients that we work with. So to be able to fulfill these needs, we focus on the 6 domains of the Child Status Index, as we can see them on the screen. So that we can at least be able to be holistic and meet all round needs of a household or the individual children and vulnerable adults. Next. Yeah, so we provide a variety of services to prevent separation. And one of them is the mental health support, teen mothers support, which I'm going to talk more about today, the physical health support, household economic strengthening, cash transfer, mainly for the purpose of emergency support, the school feeding program, in identified schools where we have most of the children living in poor living conditions, and individual school support, life skills training, and to improve the physical living conditions in families, but also in schools. Yeah, I don't know if this is clear for you, but we did a variety of specific interventions in 2022. I'm not sure that it is clear on your end, but I'm mainly going to look at the teen mothers, which we are going to talk about. And we had identified 254 teen mothers in 2022, but we were only able to reach to 195, meaning the need was bigger than we could manage based on our resources and other factors. Let's continue. Yeah, we realized that there were very many teen mothers, as you have seen in the previous slide, 254. That's quite a lot, considering that these young girls who are supposed to be continuing with their education and probably to be able to meet their future goals. And we realized that these teen mothers have so much challenges, one of them being facing rejection from their immediate family, and ending up being placed in alternative care, including institutions. We also have the teen mothers and their babies face a double separation. Sometimes the teen mother is separated from her family, and at some point may be separated even from the baby could be separated from her. And we've been working very hard to ensure that this doesn't happen, to ensure that we preserve the family. The other challenge that the teen mothers have been facing is the families decide to cover the perpetrators. And some teen mothers require prolonged treatment, which may require a lot of resources actually, but we are happy to do so whenever we can. just to make sure that they are stable and able to continue with their life, and to prevent them from separating from their families and also from their babies. And there is also need for more resources to be able to meet the needs of these teen mothers, and even to prevent them from getting the early pregnancy as much as possible. Next. So we provide a number of support to the teen mothers, different interventions, and one may wonder how we've been able to get these teen mothers, but in our areas of operation, we have social workers. We're also working closely with the hospitals, the teachers, and the children officers, among others. So all these stakeholders and our staff help to identify the teen mothers, and after having assessments, we are able to determine which of the services are suitable to meet their needs. The services that we are offering include counseling and also mediation between the teen mothers and their parents. And this is very vital for us to prevent the double separation, because we find that once the family rejects the teen mother, sometimes they're sending them out of their families. And this poses a risk of the teen mother being separated from her own family, and even instances where these teen mothers, after being abandoned or after being chased away from their families, they can abandon they do abandon their babies. And to prevent this, we identify where they are still expectant, we find the challenges they are facing, and in the event that they are at risk of being sent away from their families, there are mediation services and counseling offered to the family, and to enable the family to accept the teen mother and their baby. Also, we facilitate access to medical services through enrollment to the National Health Insurance. And in Kenya, there is what we call Linda Mama. It's a program by the government where vulnerable mothers, including the teen mothers, can access the maternal health services for free. And we also facilitate acceptance by the teachers, where we have social workers going to the teachers and explaining the situation of the girls. And we have seen even a situation where once they go back to school, they are provided with a safe place where they can breastfeed their babies. We have their mother support, bring the baby at the time that their baby needs to breastfeed, and then they can continue with their classes like the other girls in the school. We also facilitate return to school or access to vocational training for those girls who may not be willing to go to school if they're in primary school or in secondary school. So we access them to acquire a skill training, a job training where they can at least be able to get skills to depend on themselves. We also provide life skills training to these girls, whereby they are brought together in clusters, depending on their area where they come from, and they are provided with life skills training in groups, including decision making, and how to manage their time, how they can set goals in their life, and so on. And for those who are ready and willing, and based on the situation of each teen mother, we also do the business startups, and that way they are able to contribute to meet the needs of their baby. Let's continue. Yeah, so having said that, we are happy to see successes among the teen mothers that we've supported. We have seen that through the support and the mediation, the teen mothers are accepted into their families. So the interventions have actually prevented the separation. We have also seen the reduced stigma when the teachers accept them back and give them the necessary support that they need to continue with their education. And so they're able to do so, as well as take care of their baby. We also have seen teen mothers who cannot go back to school be able to earn income, enabling them to support themselves, their personal needs, and also their baby, and also to save lives by facilitating delivery in hospital. In the past years, we've seen, especially the very young teen mothers, losing their lives trying to deliver at home or without the support of going for proper delivery in a medical facility. And the teen mothers also regain confidence and self-esteem, and they are able to face life with confidence and to support and protect their baby. Let's continue. Yeah, so if there are, yeah, we have also had some lessons learned. Yeah, we've learned that family support services can prevent separation of children from their families, and it can preserve families at the same time. And support systems like schools, hospitals, and others are a great resource in ensuring the stability of teen mothers and their babies. So yeah, maybe for those who are also working with teen mothers, I don't know what your experience is, but probably this could be maybe could be an insight. I hope so. And we have also learned that there is a need for new interventions that can reduce the teen pregnancies. And the reason why we say this is because we've been doing the life skills training, about training on reproductive health. But I can imagine because of other factors, the teen pregnancies might still be there, but there is need to have a very effective intervention which can reduce these numbers in a great way. So thank you very much. If there are any questions, they are welcome.
Thank you so much, Joan, for bringing that very important aspect of prevention to this conversation. Again, I encourage those of you who may be interested in learning more about this work with teen mothers and their babies to reach out to Joan and to Macheo. Okay, we will move on to our final panelist from Rwanda. Hopefully we'll have enough time to have some questions at the end. We are very excited to have a team of panelists today from Rwanda, and a big thanks to UNICEF Rwanda for setting this up and bringing both Mr. Naftal Rutayisiri from the National Child Development Agency in Rwanda and Mr. Felician Turatsinze from Chance for Childhood, a UNICEF partner in Rwanda, to the conversation. We also have joining us for any questions or comments, Mr. Oswald Tuyizeri from the Rwanda National Council of Persons with Disabilities, and Ms. Genevieve Uwamaria, Child Protection Officer with UNICEF Rwanda. And again, my apologies for the pronunciation. I don't know, would you all like to start with your video? I know that you've brought a short video you wanted to share with us. And this might be the time, if Genevieve, if you can try to share your screen, and then we'll use the rest of the time allotted for the presentation.
Sure. Yes.
Okay, so feel free to take over sharing from me, and we'll see if it works.
Yes.
You could just turn up your volume, I think, for the.
Let me try first with the. Oh, okay.
And then just make sure that the subtitles are visible, if you would as well.
Okay, I start.
Go ahead. We're not seeing it yet. Are you able to share your screen?
Oh, sorry.
And the sound, like we went over at the beginning. If you can share your sound after you share screen, then you'll see an option on the bottom left to share sound.
Okay, sorry, let me restart it, Erica, sorry.
No worries.
Oh.
But we're not seeing it yet.
Let me retry, I'm sorry.
If not, we'll start with the presentation and then come back. Would that be better?
Let me start sharing.
Okay. Okay.
Yeah, okay.
There we go.
Are you seeing it?
Yes, but we can't see the subtitles. Maybe if you can move it up a little bit, and the sound needs to be louder.
My God.
You can perhaps maybe full screen. Yes, that might do it. Oops, now you're not sharing.
It's gone, no?
Yes.
Share screen.
Okay, there we go. Double click to enter full screen mode.
No,
now you're showing something else.
Let's start by the presentation, then I will be ready after.
Okay, that's fine. Okay, let me go back. All right, then we'll start with our colleagues, Mr. Naftal and Mr. Felician, who are going to talk to us. I'm not sure which one of you will start first, but about prevention of family separation for children with disabilities in Rwanda.
Is starting first? Yeah, I'm starting.
Please.
So, hi everyone. Thank you so much. I am Felicia. Since you might have seen there, I work for Chance for Childhood as a senior program manager and a disability inclusion advisor. I have been working with Chance for Childhood for the past 10 years, and we have been into partnership with UNICEF for the past 5-6 years. And I'll be taking you through these key points. So I will not talk much about what Chance for Childhood is, but it is this international and governmental organization that is based in UK, and it's been in Rwanda since the past 13 years. And we are so much into child protection, like social protection and inclusive education. And as you know, Rwanda has ratified so many international conventions and protocols on child's rights, including the UNCRPD that Rwanda ratified in 2008. And this led us to this child care reform of 2013, that is the national child care reform, with the implementation strategy we called Let's Raise Children in the Families, with the goal of reintegrating children living in institutions and transforming Rwanda's child care and child protection into a system that is a family-based care that provides the maximum protection to all children, of course, including those with disabilities. In 2016, the National Council of Persons with Disabilities carried out an assessment to see how the situation is like among children with disabilities, and they found about 4,000 children with disabilities in the institutions and different centers. And in 2019, they decided to revise the operational guide. And in 2000, that's when the program, 2020, that's when the program of reintegrating children with disabilities from the institutions to the families started. So in 2021, they started a program that was called Family Strengthening and Community-Based Support for Care of Children with Disabilities in the Families. So this program was started by the government of Rwanda in the support of Chance for Childhood, funded by UNICEF Rwanda. And this program had two main objectives. The first objective was to maintain the sustain the post-placement support and to prevent the family separation for those children who have never been to the centers. With that, we started, the government of Rwanda decided to own the initiative by making sure that it sits at the center of coordination of all these activities and making sure that we generate evidence about what works and what doesn't and why not, and making sure that they're also learning key lessons from the whole child care reform system. And all these lessons have made us carry out the different kind of interventions within this program that I told you about. Next. Yes, so the main interventions of this family strengthening community-based support for care of children with disabilities in the families were, first of all, the situation analysis that we conducted to look at the needs of the parents or the service providers and the community volunteers within the communities to ensure that children with disabilities get all they need within their families and the communities. The second intervention that was carried out, of course, was to make sure that we identify all children with disabilities, those that were like transitioned from the institutions to the families, and those that have never been to the centers before. We identified them all, and we found about 6,689 children with disabilities that were in the communities of the 2 pilot districts where this program was implemented. After identifying those children with disabilities, then their parents were also identified to be in need of the knowledge about how to take appropriate care of their children and how to raise their children appropriately and how to behave in such a way that the child with disability will not feel isolated, stigmatized, or discriminated in the activities of daily living. And this is what we did in the training of the parents. But at the same time, we realized that the child with disability could not get everything they need within their family only. And that's why we also decided to train the service providers within the communities. Here we train the school head teachers, the health authorities, the local government officials, and everyone that provides the services, including the civil society organizations and the non-governmental organizations, to make sure that they are up to the knowledge of what disability is and how they can offer inclusive services to the families of children with disabilities. We also train the community volunteers, being the friends of the families, like my colleague Naftali is going to take you through that. We train them about how to support the families of children with disabilities to make sure that the needs they have, they are oriented accordingly to the service providers that we trained about how to offer inclusive services. After the training of these service providers, the parents and the community volunteers, then we referred children with disabilities to different service provision settings, including the hospitals for the health services, the rehabilitation centers for the health services, and the child protection and social protection services for those children in need of such services. And there are so many other children with disabilities that we have referred to education, this being early childhood development services, early childhood education services, TVET, special services, and universities where possible. And after these referrals, we had also made sure that we sensitize the communities at large, both those with disabilities and without disabilities, parents of children with disabilities and those without children with disabilities, to make sure that they understand the knowledge they have to understand that prevented them from kind of carrying on building on the stereotypes and traditional beliefs that were causing them to stigmatize and discriminate against children with disabilities and their families. Next. So in the parents training, these are the topics we trained them about, but they were mainly about how to raise their children with disabilities in the families and how to take appropriate care of them from the morning up to the evening, and how to establish the home ritual in such a way that the child with disability will not be a burden to the family like they used to see it before. And after the training of the parents, we grouped parents into the peer support groups that we have called parent support groups across the 2 districts. And these parent support groups had a mandate of providing group counseling and making sure that they come up with challenges, with alternatives or solutions to address the challenges we identified right from the beginning, which were mainly poverty, stigma, accessibility, and affordability related issues to the services I told you about, and mainly the challenges related to how the local authorities were not in a position to offer to them inclusive services. So this is what we are training parents about, and this is what the parent support groups were just keeping on discussing during the parent support groups meetings that were taking place on a monthly basis. Next. And after this platform, the parent support groups has been running for so many months, and the referrals we had already made during the referral monitoring, we could find that among 7,858 referrals we had made to different service providers, we could find that only 30%, including those that we referred to the hospitals for the health services, those that we refer to the rehabilitation services, education, social and child protection services, all of them, only 30% of them could get access or be enrolled into the services that were being provided by those service providers I mentioned above. And the remaining 70 were not able to get enrolled in the services because of the poverty that was not allowing them to keep their attendance, and also the accessibility, be it the difficult traveling to the services, the affordability of the services, the medical bills, and the cost that they required of during the rehabilitation services, and the cost that they had to pay for the schools where applicable. All this prevented this 70% from getting enrolled in the services they were meant to receive. And the government and the Chance for Childhood, by the support of UNICEF, we sat down and thought about how we can address this challenge. And that's why we decided to provide physical rehabilitation to about 1,284 children within their communities. So we created the rehabilitation sites within the communities, and we made sure that we appoint physiotherapists to offer these rehabilitation services on a weekly basis to ensure that these children get the service they would just get if they went to the rehabilitation centers, but they couldn't go because of the challenges I mentioned. And these physiotherapists were really doing great in such a way that we have so many children that couldn't just walk and stand up and walk that are nowadays able to do so. And we had so many children that were considered to be a burden to the families that are no longer the burdens to the families because they are taking a part in the activities of daily living within their families. Within this 1,284 children, we also identified about 184 children that were so much in need of assistive devices, and we provided the locally made assistive devices using the paper-based technology, the wood, to make sure that we make the corner seats, the walking frame, the standing frames, and the parallel bars to support these children in the activities of daily living and in transitional movements from line spine up to standing and walking, and be able to participate in the activities of daily living or the family cause with the parents and the siblings. And it's within these families that we also carried out the accessibility audit to see whether the assistive devices we are providing to these children are going to be helpful, because so many families are located in the remote areas, in the uneven surfaces where people cannot, children cannot even make use of these assistive devices. So we were advising the families and supporting the families how to adjust their surfaces in such a way that the assistive devices we are providing will be of use, so that these children can come from one level to another level, which will end up helping them be active people within their families. Next. And from here, I would like to hand it to my colleague Naftan, who will carry on telling you about how we have been working with the community volunteers in all of these interventions have been carrying out. Thank you.
Thank you so much, Felicien. So Naftan, please go ahead.
Hello, everyone. My name is Rutaisiri Naftali, and I work with the National Child Development Agency as coordinator for all the activities of Friends of Families. Friends of Families are child protection community volunteers who were established in 2016, and we are put in place by Ministry of Gender and Family Promotion through the former National Commission for Children, but now National Child Development Agency, of course, with its partners, UNICEF, Hope and Homes for Children, Save the Children, to mention but a few. Next. The issues are two, a male and a female, based in each village, and in total we have 29,674 friends of families all over the country. You will hear me just using issues. It's abbreviation of Inshuti z'umuryango, we call them Inshuti z'umuryango, but in English they are called friends of families. Their role is, first of all, early identification and referral of child protection cases. They do support, when they were put in place, they were given different types of trainings to enable them to carry on their duties. And they are identified by their fellow community members during different forums, community forums. And in prevention, they do visit families, and in most cases they are able to identify children at risk of separating with their families, especially in this case children with disabilities. And once they are identified, they are able to refer or to report such cases to the service providers and even local government for the support. The issues do not work alone, as I mentioned. They do work with, of course, with other community volunteers such as National Council for People with Disabilities, community health workers, youth committee, children forum committees, National Many Council. It depends on the case. If it is a case that that is related to health, then they work with community health workers and, of course, with community facilities available. They also do, the prevention is also done through the messages that they do give to the community members, of course, through community forums, especially during family evenings. In Uganda, they are given a platform to deliver messages on child protection. For example, they can deliver messages on how to prevent stigma against children with disability, messages on how, on positive parenting, messages on how to prevent abuse, etc. Then they also support in referral, because they were trained on referral pathways. So in case there is a case of child abuse that is identified, the issues do work closely with the families, local government, to refer the case where it is supposed to be referred to the service providers, to the appropriate service providers. And finally, they also have a mechanism of reporting whereby they have 711 USSD, whereby they do report all the emergency case, child protection cases reported on a daily basis. And our colleagues, child protection and welfare officers at the district level, are able to absorb such cases and then provide the necessary interventions. As I said, for the friends of families to carry on their duties, they are provided with a series of trainings. Of the latest one is the training that they received on how to support children with disabilities and their families. There were the different training manuals we are developed together with the support with UNICEF. There was a trainees guide, a trainer's guide on ISO at the decentralized level, then facilitators manual for the trainees, and also the parents sheet, which is used to train parents in the communities on how to support their children with disabilities. The mentioned manuals we are developed in a simplified way and translated in Kinyarwanda such that it is understood by the friends of families and also by the parents. Next. Now, lessons learned. My colleague mentioned about the enumeration that was carried out to identify all the children with disabilities in all over the country, in all villages. It was an opportunity to identify all the children with disabilities who were hidden deep in the villages, and they were supported to also to receive the necessary services. Next lesson learned is that locally made devices we are made for these children with disabilities, and they are now able to move and also to participate in all activities like other children. The well-being for children with disabilities was improved because, as I mentioned earlier, all the parents and community members with children with disabilities, we are trained on how to support their children with disabilities, and so this improved the well-being of children in areas related to be the areas of health. Now they know where they can access. For example, they know that when disability is detected at an early stage, the children can be treated.
So sorry, I think I lost my connection.
Yeah. And
I
then
think
the last one, though the presentation is not on the screen. The last one is that it was learned that when the government owns the inclusion of children with disability, that's when it works better. That's when we are sure of its sustainability. Thank you.
Thank you so much, Naftali, and I'm so sorry about the presentation. I think we can see it now, but apologies. We are running short on time. It's so difficult because there is so much rich learning and innovations to be shared. We really appreciate just hearing about all this great work on prevention of separation of children with disabilities in Rwanda. Thank you so much. I'd like to just open it up now in the interest of time. I'm afraid we're not going to have time to try to share the video, but I know we'd all like to see it. And I'm hoping, Genevieve or Mona, that we can perhaps share the link in the chat and people can see it afterwards, or maybe Emily, there's a way too that we can share it together with the recording of this webinar. But I'd like to open it up for questions now. I'm not monitoring the chat because I'm still sharing, but
Erica, there are a couple of questions already in the chat box, which I've listed there, and I've asked people to provide some further questions. Shall I read those out as a starting point? So what outcomes, I think both of these questions related to the first presentation. What outcomes and measurements are there at child and family level, and what is the threshold for graduation? That's the first set of questions. And then there's another question. The graduation approach was really insightful, wondering what was the implementation in urban, peri-urban areas. Besides the given thresholds, are there any you think we may include?
Wonderful. So I think that those questions would be for Chilala from ACE.
Yes, I believe so. That they came up right at the start, right after that presentation.
So, Chilala, again, in the interest of time, maybe if you could just give us a short response, maybe just a couple of minutes to those questions.
Okay, thank you, Erica. So the graduation approach, it was implemented in the urban area as well as the rural area. And then the other question on the threshold for graduation, if you saw the graph that I shared, on the graph that was shared was indicating a 2-year period. But from the lessons we've learned, we recommend a 1-year period, as long as the services that are offered are intensive family support services. I hope I have not missed any question. Have I answered all the questions?
I think so. Was there another question that you wanted to share, Emily, from the chat?
Those are the only ones that we've received so far.
Okay.
I don't know if anybody else has any further questions. You can also raise your hand and you can ask your question out loud or type it into the chat box.
And maybe just to emphasize that in the interest of time, I try to go through everything as quickly as possible. So I would love to mention that before we started the GA, there was actually a training that was conducted, which is very important for the implementers. And I also mentioned the transit homes. The transit homes are a response pillar, but only for children that cannot be reintegrated immediately. And they can only be there in the shortest period of time when necessary. So everything we're doing, we're working with the government, and there's also support from UNICEF.
Yeah, that's so important. Thank you so much. If we don't have other questions from the participants, I'd like to ask our Rwanda colleagues. Well, there is a question here that I'll let you answer. What is the correct term to use? Is it children with disabilities or children with special needs? So I'll let you answer that. But also, if you could just, very briefly, based on the learning that you all have had in Rwanda from this experience in preventing separation, what recommendations would you have for other countries, other governments, other implementing organizations for trying to replicate or adapt to the experience you've had in Rwanda to their country context? If you could, please.
Yeah. Thank you. May I come in?
Please.
Yeah, thank you, Emily, or Erica, sorry. For the terminology that we are using, we are always using children with disabilities. This is according to the UNCRPD terminology and also the National Constitution of Rwanda, because we also related to persons with disabilities. Then when it comes to children, we talk about the children with disabilities. I think this is also the terminology which is given by UNICEF globally. And when it comes to the advice or the recommendation that you would give to a country, my colleagues will also jump in if I forget something. I'm thinking, first of all, of ownership. Anything which is being implemented for children with disabilities should be embedded within existing systems. It is very much recommended to avoid the parallel implementation of standalone projects, which in the end would not lead to sustainability. And of course, there are some challenges associated to this, because sometimes you may see that things are moving slowly, but you move slowly, but you go also surely as you change the systems, as you bring together different sectors like the health, the education, the social protection together through existing system and schemes, it is very much sustainable. And also, the other recommendation is to look in the own context and they try to innovate more without necessarily looking for everything that comes from other countries or from high technology. I'm thinking, for example, in terms of the assistive technology, assistive devices that you have provided. There were like many children who need assistive devices, but they are so expensive. So we have part of them were provided with the locally made assistive devices, which are very, very cheap, affordable, and it has been helpful. Of course, we still have those who have not been able to serve with the high technology like wheelchairs, audiometers, and so on. But this is something that can still be explored. But at least it was possible to fulfill what can be fulfilled at a local level. Thank you. My colleagues may have maybe something that I would have forgotten.
Thanks, Genevieve. Erica, if I may come in to add a bit of
Yes, please, just very briefly. Thank you.
Yeah, thank you so much. So I wanted just to give the difference between children with special needs and children with disabilities. Children with special needs are all these children who are from the situations, the disadvantaged situations, like street-connected children, the conflicts with the law, children that are born from the teen mothers, all these, all are children with special needs because they need to be treated in such a special way for them to meet the standard ways of living. But children with disabilities are all these children who have their body functions and impairments that are not able to help them like take part in the activities of daily living and or participate in the society. So all this is what Genevieve has well explained, that they are children with disabilities according to the UNCRPD and to the Rwandan Constitution. And my recommendation would be that there are so many children with disabilities in the communities, but they are still hidden and or unknown. Therefore, there need to be a thorough kind of identification of those children and make sure that the government addresses the problems that are related to accessibility, affordability, and availability of the services within the communities by implementing the community-based rehabilitation approach that tackles about 5 key things. This is health, education, livelihood, social, and empowerment. So by so doing, children with disabilities and those with other special needs, including special educational needs, their needs will be addressed within the communities with no more problems. Thanks.
Okay, wonderful. Thank you so much. I know we're just about out of time, but Joan, if you would like to address that question for just 1 minute, what recommendations would you give to other countries that might be interested in adapting your approach to preventing double separation with teen mothers and babies? Is there any sort of quick advice or recommendations you might have?
Yeah, I think, sorry? Yeah, I think the recommendation I would give is early identification of the teen mothers and also quickly connecting with their families to see how their relationship with the family members are, especially the immediate family members, and identifying if there are any relationship issues in regard to how they're accepting the issue of the teen mother and coming in early enough to offer guidance and support and also to intervene if there are other challenges that could be making this family not accept the teen mother, so that we can prevent the teen mother being sent away from the family or the teen mother abandoning her baby. So the early identification is very important, but even more to try and introduce those interventions that could reduce the teen pregnancies.
Okay, thank you so much, Joan. There are other questions in the chat. Clearly, there's a lot of interest in this topic. Mona, perhaps you can say something as you close about how we might continue to exchange information among these various experiences. But I'll turn it back over to you. Thank you so much to all our presenters for sharing their valuable time and experience with us today. I know we've all learned a lot. Mona, I'll give it back to you. Thank you so much. Please do watch the video, the Rwanda video that we weren't able to see today. It's shared in the chat on the YouTube channel. Mona?
Brilliant, thank you. Thank you so much, Erica, for moderating this session. Special thanks to the esteemed panelists for sharing your respective experiences. Again, each time I log into these webinars, I'm learning a lot on what countries are doing in the area of childcare reform. And for today, it's really preserving that family unit to avoid family separation. So really special thanks to all of you for managing to share your experience. And of course, as Erica mentioned, we'll continue to provide a platform for learning, and do subscribe to the mailing list that has been shared in the chat box. And we will also continue to share with you the monthly newsletters with information about the platform activities and also future webinars. So with that, I also want to thank Emily, Bertha, and the team of consultants for the coordination and other work behind the scene to organize this webinar. Just a quick announcement: the next webinar for this year is likely to be on climate change and care, and this is going to happen in March. We'll share more details nearer the time through the newsletter, but also we'll send an email to the UNICEF colleagues who can then share with partners at country level. So do look out for that. We'll give you more information on what that webinar will be about. As I mentioned at the beginning, we are entering phase 3 of the platform, and we'd like to use this opportunity to reflect on the progress and kind of find out from you about the priorities for this year ahead. We're going to do a short poll again, and please, if you have time, do take time to let us know and give us feedback on how you're finding this learning session. And most importantly, please complete a slightly longer survey. The link is going to be shared in the chat box, which will only take you about 5 minutes, because we really want to make sure that this platform is relevant to your needs, and your feedback is so important to us. Would also like to expand the platform to reach more people, especially those in government, and more specifically the workforce, the social workers, and others working directly with children. So please reach out to colleagues to ask them to join our mailing list, and that information is again provided in the chat box. Do take time to fill in the survey, and do let us know your thoughts on that. So with that, I thank you all very much. We will share the webinar recording and the resources that were presented today through the mailing list, and really looking forward to having more interactions with you. Thank you, and have a good rest of the day. Goodbye.
Bye-bye. Thank you.
Thank you, everyone.